ANO and all senior sisters, staff and technicians. Today is a very auspicious day for us to start a continuous medical education program for CA nurses, which was already been long back, had been started in our hospital. And in this year we will continue with new thought, with new ideas. And what is the aim for CME for nurses? The purpose for aim is that we have to enhance the knowledge to improve nursing practices and patient's outcome as required for the modern healthcare delivery systems. So why we need a absolutely nursing care with scientific basis, with holistic approach, good clinical judgment, early patients assessment, problem assessment, and work with the coordinated effort care with your specialist doctors. So that's why we have now in every month for Central Hospital nursing, probably we are around 130 plus here. Every month 1 hour only will give dedicate time for continuous nursing education, and most of your speaker will be from our own fraternity. Most of our senior nursing staff was working in different facility. Most of them are working as a specialist nurse in different department. So you can exchange your ideas. You see, we look at the downholes, loopholes, and try to improve the care and share with the other sisters. Someone is working in different faculty, try to develop and try to improve your own knowledge. At the same time, you come back with this nursing care with other institute, particularly your corporate hospitals, what they are doing, what you are doing. How can you differ from her? If is there any loopholes, if there is any lacking, what you need training, or you need upgradation of your knowledge, or equipment care, all things you can discuss in this forum. So every month, last Friday, evening time, as for your convenience, 3 to 4 or 4 to 5, 1 hour time, you have to dedicate them. Most of them, those who are interested, that is our purpose, and it will be sanctioned by our senior administrator of home hospital. They are very happy. Today we have said we will start today, and we have given them some common topic like vein placement, vascular access, various fluid therapy challenges, then CPR, drugs, defibrillator, monitoring, various monitoring of this, different pacing, bradycardia management, and infection control, very challenging job, pre and post operative cares, gynae for safe delivery, and documentation and record keepings, and last is the communication skills. So these are the some topic what we have selected. Gradually, as per your convenience, you have to develop your own topic, what is important to you, and we will continue for this to upgrade things. As we know, the medical science is ever changing. What we have seen in 80s and what in 2010, this decade, there is a huge change. There is sky and these differences. So a lot of new instruments have come up, new challenges have come up. So we have to cope up with that. So it is a basically continuous medical education. As for doctors we used to do, we usually meet for 1 hour in week for multi-dimensional activity. Here once in a month we have to do for that. Now that at the same time we have to keep that if we are seeing the younger, more and younger sisters is coming, they are more tuned for these changes, not most of the equipment. Now everything is digital based, digitalized based your treatment. Most of the equipments are most modern equipments having fully related with computer knowledge. They are giving the in ready-made reporting. There are many dimensional pictures in every faculty. So as I am dealing with most of the cardiology patients, we have a team of working of cardiac nursing. Cardiac nursing is a specialist nursing, whether you have to be very much upgraded with the various instrumentation and this. So today, as for started, we start regarding the work of the various cardiac gadgets, and all of you are working daily with them. So what are the this will start? Look, this is the you all are using the sphygmometer. This machine has been developed by one Rivaroxy 200-300 years before. Rivaroxy when discovered, this is the mercury column. This is known as the bladder of this, and this is the pump, and this is the tube. When we are mixing with this, so this is the one traditional your blood pressure instrument, and using this whole thing is the accuracy of report. We are daily documenting our house staff, DNB doctors, young doctors used to take, sister used to take the pump. How to keep in the correct reading? This BP instrumentation is basically of this sound when you are putting this over the brachial artery. This sound, what you are having known as Korotkov sound. Korotkov was the name of scientist who discovered this theory. So Korotkov sound, the first sound is the after the systolic sound what you are getting, that is the S1 sound. This sound, there are 4 phases, 1, 2, 3, 4 and 5. So then the diastolic sound is the your when there is a vanishes. One is the muffled, one is the vanishes. So correct reading of even BP means up sound, upper sound and followed by your the generally we are taking muffling of the sound, but sometimes like pregnancy when you are between complete muffling or absent, generally absent sound you are taking, but muffling sound AR or pregnancy or anemia used to take. So correct reading of the diastolic, correct reading of the systolic. This is easy. Sometimes we are expecting bias. Expectation bias means just we have pump it 140 but 130. No, this is you have to 4 to 5 mm decline in slowly, and then you see which place it will vanish. So it is an important instrument, although it is known to everyone, but accuracy is very important. Second, when you are keeping, you have to keep this valve so that it should not get, you have to close the, here there is a circuit menu here, so that this should not get it damaged. The function is that you have to keep record in this as well as keep the for or the in a safe mode. So that is the one instrument you have to be important here. Second important gadget our after in cardiology practice is the ECG. There are many type of ECG. Either you have to see the one is the very common ECG machine is this. Whether you have